Well, this morning, news from Wisconsin Governor Tony Evers that it may be June before coronavirus vaccine is widely available in Wisconsin. At some point, though, all of us will have to decide whether we want to get the shot. This morning, we take a look at some of the myths that you may be hearing and what you should know. The COVID vaccine is rolling out, but a recent poll from the Kaiser Family Foundation found only about 3/4 of Americans would likely get it, and some are having second thoughts.
I don't think vaccines are necessary for the flu.
Absolutely, I would be first in line for it.
Maybe it may change your DNA.
It's hard to tell what information is real and what's not.
One myth floating around is that the vaccine will make you test positive. A COVID-19 vaccine will not reflect as a current infection on a viral test. You may expect to test positive for COVID antibodies if you indeed develop an immune response. Myth number 2, I don't need the vaccine if I've already had the virus. If you have already been sick, doctors suggest you can still benefit from the vaccine. It will protect you both from getting sick again or becoming a carrier. And here's one more. It's better to achieve herd immunity through natural infection. Well, this is the idea of simply letting the virus work through the population, eventually infecting so many people, there are few left to catch it. Here's the big problem with that. According to a projection from the University of Washington, it would mean 1 million deaths in the U.S. and likely at least 13 million across the globe.
So that's important that people still be mindful of getting their vaccines.
Vaccine or not, health experts continue to say the best protection is in our hands.
Being a good citizen, wearing your mask, socially distancing yourself if you're feeling sick, or just avoiding large crowds, frequent hand washing, all those things will continue to be important.
And they say one of the most common myths is vaccines actually give you the virus. While vaccines in this case do protect you, they do not infect you. The CDC says the vaccines typically contain only a single protein of an inactivated or dead virus.